Hi, it's Lacey Kells. Welcome to Fayetteville Pelvic Health and Wellness. I'm going to talk about belly breathing today. So this is a very quick, simple version of belly breathing. There's a lot of information about breathing out there right now, and we could go into a lot more detail, but I wanted to put this out there just so that you guys understand the basics of it, because it's really, really important. This is one of the very first things that I teach every person that walks into my clinic, because it's that important in taking care of your body from head to toe. When we breathe properly with our bellies, it actually impacts our nervous system, so it takes us out of that fight or flight state of being, which increases inflammation, anxiety, reduces our digestion. It impacts digestion in a negative way. When we breathe into our bellies and not into our chests, we actually activate the parasympathetic nervous system, which is our rest and digest system. It reduces inflammation, relaxes muscles, reduces anxiety, and really keeps us in a much better state of being, head to toe. So first thing you're going to do is get your knees bent. That keeps your pelvis in a neutral position and allows us better access to our abdomen. So I like doing it with my knees bent. I have a yoga bolster under my knees. You can use a pillow or put your feet up on a chair, or if this is just not a comfortable position, you can certainly extend your legs. We're going to put one hand on our bellies, one hand on our chest, and the goal is to feel this hand on our bellies moving more than this hand. Okay, so when I breathe into my chest, you can see that my top hand is moving a good bit. I mean, you can see my elbow rising and falling. This is going to stimulate my sympathetic nervous system, my fight or flight nervous system, to turn on. This is not so good for me. If I can shift my breath down into my belly, it's going to be much better, not only for my nervous system, but for my abdominal muscles, ribs, low back, and pelvic floor. So I'm taking slow, deep breaths in through my nose, out through my mouth, and I'm allowing my belly to gently rise and fall as I inhale. It's different than me trying to force my belly out. It's just relaxing these abdominal muscles to allow the belly to rise and fall. What's also happening, we can also feel into our ribs. And you can see my hands moving as my ribs expand outward and then come back in towards the midline. Okay, now you're going to do this for 4 to 5 minutes, and you want to practice it consistently. Your body is going to get into a better habit. This is going to help your abdominal muscles work a little bit better because they're in a more relaxed state. You're going to get some impacts into your low back. Ribs will move better, which is going to help your mid back and even into your neck. And then, interestingly enough, every time we breathe in, the pelvic floor drops with the diaphragm, which is our breathing muscle right here. So every time we inhale, we get this lowering of the diaphragm and dropping of the pelvic floor. And then as we exhale, both pelvic floor and diaphragm recoil back up, abdomen draws in, ribs come back to center. So this is diaphragmatic breathing. It's super, super important, and it can help you really head to toe. And again, it's one of the first things that I teach anybody that walks into my clinic. So I hope this was helpful. I hope you guys will practice it because it has so many benefits. As always, if you have any questions, send me an email, comment on here, or find me on Facebook or